My practice, which is hip and knee replacement, we have migrated toward a practice that really facilitates patients getting up the same day and walking on their hip or knee, whereas traditionally when hip and knee replacement was first starting, patients would stay in bed for 2 or 3 weeks. So it's been an amazing change over the years in terms of the philosophy of how best to take care of these patients. What we have found is that in implementing early mobilization, we're able to even extrapolate that and expand that to outpatient surgery, where we're doing hip and knee replacements in a same-day fashion, where patients come in the morning, they have their hip or knee replaced. That morning they work with physical therapy, later that morning into the afternoon, and then they go home. They don't have to stay in the hospital. And that has to do with not only early mobilization and a rapid recovery protocol, but also a multimodal pain management protocol, which we've been using for several years now. We found that this has been very effective in getting patients home the same day, which really does improve their overall outcomes.